Good morning. We are live again here in Mesquite today. I am Terry Narens with the Virgin River Times, and we are happy to have Doc Vern back. Seems to be one of our most popular guests. I get stopped on the street, people telling me they love to hear the podcast that you've been on. So thank you very much, Vern, for joining us.
Well, thank you. I appreciate sharing information,
And it's good to see you today.
and it's good to be seen.
That's always his pat answer. So, Doc Vern, today I had requested because I have heard quite a few of Doc Vern's stories that he has told over the years, and some of them seem pretty incredible, pretty amazing, and they are. So, I've asked Doc Vern to share some of those most peculiar cases with us. And he's agreed to do that today. So you see here on the screen the X-ray thing. I understand you can't see it too well in the camera and everything, but we have another camera set up. I'll be showing it on my cell phone when Doc gets to talking about that particular case. We'll turn it on for you, so you'll be able to see a lot more clearly what's on the X-rays. So I'm going to just pass on over to you, Doc. What would you like to talk about today?
Well, I'll give you a little bit of history about the chiropractic education. For many, many years, chiropractors were accused of getting their diplomas mail order and all sorts of things. They didn't have to have any training. Well, the information that they were using clear back when chiropractic first started. And at that same time era, the medical profession did not have a really good established curriculum for teaching medical students. A lot of it was done by on the job training, so to speak. And that was the way that chiropractors were. The thing that the chiropractors concentrated on originally was the human anatomy, and that is the basis for all health care is human anatomy and function.
Which is physiology.
Yes, and those are the same subjects. When I was in college, we didn't there weren't colleges set up to give the so-called pre-med to chiropractors because at that time it wasn't really accepted and the philosophy was different. We concentrated most on the spinal column and the nervous system, and we didn't get into drugs and medications because we had no need for it. That was not part of our protocol. And so naturally, we weren't trained in that.
Not even when somebody had a spinal injury?
Now, a spinal injury in what regard?
Well, I don't know, slipped a disc or ruptured a disc, or, they're in an extreme amount of pain. um,
Oh, yes, from that aspect, and I'm going to clarify one thing. You brought that up. And right to this day, I do not know where they're coming from. And let me assure you, folks, that there is no such thing as a slipped disc. You want me to repeat that, or did you get that? There is no such thing as a slipped disc. and it just happens, and I wasn't planning on doing this, but I guess I need to clarify what I'm talking about. Right here is a
Here,
replica
put it up here.
of a spinal column. And it just happens that right down here, if you can see that, there's a red dot.
Here, you hold that. Let me
a
get
red
my
spot
phone.
looks like a piece of plastic, which it is. It's because this is a replica. This is not an actual spine. Okay, can you see that red thing bulging out there? That represents a bulged or a herniated or ruptured disc. That is not a slip disc. If you have that condition in your spine, I don't care who it is, you can have manipulation done on this. You can do anything you want to that, but it's not going to be something that'll be gone tomorrow morning. They can say, oh, I had a slip disc and I stretched or I pulled or I twisted or something and the disc slipped back in. Well, that doesn't happen. It just does not happen. Something like this, you're looking at a minimum of 6 months if it heals itself, and maybe never. And this can be surgically corrected, but that's not always the right answer anyway. Anyway, keep in mind there is no slip thing as a slip disc. It either ruptures or it herniates or it bulges, but it is not something that slips in and out, because that disc is an integral part of the bone structure. The disc itself grows right out of the bone cell structure and forms cartilage. You have these pads in between each and every vertebra in your spine. There's 26 of them, vertebra. Each one of them have a disc. Those discs are cartilage pads. And this is what gives you mobility as well as cushioning to your spine. While we're there, I'll give you something in passing that you probably heard, that when you get older, you lose height. That is true. You do lose height. Each one of these discs is a certain thickness, depending on the height of the person to start with, a lot of it. But the discs will range from possibly 3/16 of an inch up to 3/8 of an inch, quarter of an inch. Those discs are made 90% water. When we get older, all of us, starting at as early as age 35, start to dehydrate. So when you get 26 discs that lose about half of their height because of dehydration, you can lose anywhere from 3 to 6 inches of height, actual measurable height. So that is not a fallacy.
Wow. Well, my mother used to be a taller woman than I was. And as she got older, she sure shrunk down quite a bit. All right, guys, I'm going to turn this second camera off here because we're getting all over the place. Just for a moment. I will turn it back on when we need to. So,
okay, now back to the education and training. So the chiropractic profession at the time that I got my license in 1961, we had a 4-year curriculum to get the chiropractic degree. Depending on the state that you were in, some required 2 years training, others required 4 years. It depended on the state. But at that time, all healing arts professionals, dentists, osteopaths, chiropractors, MDs, all of them had to pass what's called the basic science examination. Now, that is an examination that was set up by each state. You sat down, you didn't know who it was sitting next to you, what profession they were. You took the same test. The test was in anatomy, chemistry, organic and inorganic chemistry, neurology, all through the basic sciences of healthcare. You had digestive system, immunology, all of these things had to be passed by a particular test, and it was called the basic science. So
it didn't matter what level or what medical, profession you went into, like you said, chiropractors, orthodontists, dentists, osteopaths.
that's right. They had
Everybody.
the same basic thing. But a problem that they had with that is most of the exams were favored toward the use of medicine and chemistry involving medicine. A lot of the tests, one of them, when the first time I took my exam, it had questions about chemotherapy. But that time, chemotherapy we just barely heard of. I had no idea what they were talking about. But those questions were still on the exam. Now, since that time, everything is involved, and I don't think any of the states have a basic science exam now. Most of the exams, you have to pass a certain level before you get a license in that particular state. Well, it's national. And to be honest with you, if I had to take an exam today, I question whether I could pass it or not. Because I remember organic and inorganic biochemistry, but I certainly don't remember all those formulas and how the hydrocarbons work and make sugar, and you throw in a few extra particles of carbon and oxygen and it becomes sugar instead of alcohol. But I don't need to have that, don't need that information anymore.
Because you know the basics of how it works, and
I use what of it I need. And I'm retired, so I don't need a whole lot of it. My body knows all about that stuff. It
Right.
takes care of me while I'm asleep.
Yeah.
So I don't have to remember that. But anyway, we had a 4-year curriculum, and I chose to not take summers off. And so I went through the summer carrying full credits and got my degree within 3 years rather than 4.
And he did this while raising a family, married, 3 kids, 4 kids.
At the time I graduated, I had 4 children. And
Good
I
man,
didn't
worked
have
full-time.
any student loans, and I didn't have anybody paying off the officials to get me into that college. Part of my training was paid for by my GI Bill. I did have the GI Bill when I got out of the military.
And thank you for your service.
Then in getting the degree, we had to have training of some sort. The medical doctors have their hospitals, clinics that they can do internship. Chiropractors don't have that.
No.
So what do? You still need the training. So we had a clinic that was combined with the college, and people off the street would come in, and we were able to take x-rays on them, go through a full routine exam, doing blood tests if they were necessary, and do the whole thing. And they became patients under the direction of advisors. They were always under the care. And another thing that we were able to do is when freshman classes came into the college, they and their families, if they had them, were assigned to some of the senior doctors and became their patients. This is one of the stories I may have told you about it before, but it just happened that one of my classmates finally just had one child, but I already had 4 children that I was able, under the direction of the professors, treat my family as patients. But I had the experience of working with children. But this classmate, and I think he's passed away by now, but his name was Walter and his wife's name was Wanda. But Wanda became one of my patients. So she, during the schooling, became pregnant and had a baby. But prior to her having a baby, she was under my care because she was subject to migraine headaches. Well, she went into the hospital to have the baby, and under all this stress, she got a migraine headache. So I have to admit, we went in and I eventually gave her manipulation on her neck and got rid of the migraine headache. But the problem was chiropractic was not accepted in that, so we had to kind of do this thing under the table. Well, at that time, only the father was allowed to visit the wife in the hospital. So the husband has to be there, and I have to be there to give her the treatment. So we walk up to the nurse's desk. The nurse says, "Who are you here to see?" "I'm here to see Mrs. Aiken." "Okay, go ahead." She asks me, "Where are you? Who are you here for?" And I said, "I'm here to see Mrs. Aiken." And she said, "Well, only the father can go in." And she said, "So who is the father?" And I says, "Ma'am, we're not sure." And while her jaw was still laying on the counter, I walked in, I gave her the adjustment, headache gone, we went home. So months after that, Wanda's thinking, now how did you get in the hospital to adjust my neck? And I told her, well, it's a wonder that I'm still here. She said, no wonder all those nurses were pointing at me and laughing down their shirt sleeve.
And this was at a time when it wasn't exactly acceptable to be promiscuous.
Oh yes, but that's just a fun story. We had a lot of fun with that story.
Oh, you devil. So did you ever end up having to pay child support?
No. That was we resolved that.
Well, thank goodness.
Everybody graduated and they went to Florida and I went to Utah. Because when I first started practice in Utah, I lived in Morgan and I didn't have any money to start an office. You open an office, get a degree, and that's only part way. You have to have an office. You have to then have equipment to work with. And I had to have my father send me his gas credit card so that I could even get from Iowa to Utah, because I didn't have enough cash to pay my own way back to Utah. So consequently, I had to take part-time work and sometimes full-time work to go along with my practice. But it happened that a chiropractor and his wife, also a chiropractor, had a business in Roy, Utah. And the man died of a heart attack. So I was able to move into that office and start practice in that office.
Oh, and he already had
With-
most of the equipment and everything.
Yes, he already had the equipment and his wife was still there. But she was a chiropractor, but she was not a chiropractor. And I'll get into that part of the story here a little bit later. But while I was in that office, I was there for 2 years. And then I finally, I couldn't stand the politics involved in the office with me working for the wife that owned the business, and that just didn't work out. But it just happened that a very interesting patient came in one day. And so I naturally took the case history, found out what was happening with him. He said, well, I've just gotten this kind of stiff neck here lately. And he says, I can't turn my head as far as I used to. And he says, it's just very uncomfortable. And so I did a palpation exam on his neck and went through the range of motion side to side. And I could definitely see there was restricted motion. So I didn't require it all the time, probably not as much as I should, but I didn't believe in x-raying every person. And I still think x-rays are overused right to this day. But nonetheless, I took a series of x-rays. And at that time, the x-ray was taken. Then you had to take the thing out in a bucky, piece of film, take it into the dark room, put it in the developing tanks, put it in the fixture tanks, put it in the rinsing tanks, and hang it up on the wall, and up on the hangers, let the thing dry. And so, in taking the picture out of the developer and checking it for contrast up at the dark light, I could immediately see some problems with this x-ray. I got the contrast I wanted, put it in the fixture, waited until the fixture had been in the fixture the required amount of time, then hung the films up to dry. And by that time, I was fuming, absolutely fuming. Now I'll tell you why. We'll turn the camera on now.
Hang on, give me 1 second to set this up here.
Okay, that's a side view of the human skull. You can see one lone tooth there on the bottom jawbone. You can see the vertebra of the cervical spine. Okay, I'll point out in a minute. But see that spot right there? Now that is not normal. If you had one of those in your neck in that position, you'd be in a lot of trouble. I guarantee you. Okay, moved over to that next one. I wasn't satisfied. I took that view. That's a straight on view. You can see that one lone tooth there, the bottom tooth that most of them are missing, and the cervical spine. Now, look at the one down on this side. Now that's a view taking from down the neck looking upward through the jawbone and the base of the skull.
Is that the tooth?
No, that one doesn't show.
Okay.
This is the metal.
Oops. I cut us off. Hang on a second. Okay, there you go.
Now this thing right here, that's a piece of metal. It was obvious to me that it was a piece of metal. So now, if you were a young practicing doctor and someone came in with that situation, would you not be a little bit frustrated? And so I wasn't very kind with this man.
I mean, he obviously he knew that was in there, right?
Well, yes, you don't get something like that inside of your head and your neck without you knowing something happened. And so my first words to me, and pardon my wording here, I says, what in the hell are you trying to pull, and who are you, and why are you here in my office? Now, what I suspected, and this was happening, they were sending people around and setting them up for malpractice suits. And I had already threatened to throw one person out of my office without opening the door first, because I knew he was there to set me up. And I thought, here's another go around and why. And so he, again, at this time became very apologetic. And he says, oh, I'm sorry. He said, I did not mention it, but there is a piece of metal inside of my neck there. And he said, it's been so long ago that I didn't remember it. And I can appreciate that now, because this happened 37 years prior to when he came into my office. That piece of metal had been in his neck for 37 years. It happened when he was a teenager at age 17.
How did it happen?
So
How did something
the
like that
story
happen?
that he got, he was a teenager messing around, doing stupid things like many do. And he decided to make himself a zip gun. So he got a piece of brass tubing. He taped some kind of a handle on it, friction tape or baling wire or something. Then he went out with a hacksaw to a frame of a 1934 Ford car and cut off this piece of brake rod.
Oh no. So
And
that's
then
what that
he took
is.
that piece of brake rod and hammered it in the end of this brass tubing to make himself the zip gun. And just in front of where this piece of metal reached, he drilled a tiny hole. Then he proceeds to take a 12 gauge shotgun shell apart, take the powder, and he dumps most of the powder down this brass tube. Then he puts a wad of cotton. Then he takes BBs and dumps them down, and then another wad of cotton, and stuffs it down in this barrel of this zip gun. So he takes it out in the backyard and sets up the target and drops a lighted match head down in this hole and ignited the gunpowder. And naturally, the BBs went out one end, the brake rod came out the other end and hit him in the eye, above the eyeball, and it hit the floor of his skull and diverted it down into his neck. Now this is in soft tissue, and in the process it severed his right optical nerve. So this then made him blind in the one eye, but here's this piece of metal sitting in here. He went to the hospital. They did not know where the piece of metal was. Taking x-rays, they found it. And at that time, their surgical procedures were certainly not equal to what they are today. So they gave the parents the choice. We can go in and try to operate on it, and we will probably kill him on the operating table. Or we can just leave it, but with that being a rusty piece of metal, infection will probably set in, and he will be dead within a week from infection.
That wasn't much of a choice, was it?
They said, we will take the week. So they took him home and cared for him. So 37 years later, he walks into my office, and that was the first time in 37 years that he had ever had a re-x-ray.
And in 37 years had never had a problem with it, obviously. No infections, no metal allergies, no nothing. Wow.
And I suggested to him at that time that they could probably go in and probably go through the back of his throat and remove it. And he said, it's been there for 37 years. I'm not going to mess with it.
Right.
And I said, if it was mine, I wouldn't either.
Wow.
He certainly now has passed away. But I've kept these films all these years, and I even got his permission to show these films. Now, if I did this, HIPAA would be down here hauling me off to jail.
Yeah, right.
By releasing patient information.
HIPAA would be all over you, Doc.
Yes. You never know what happens.
Wow. So I'm going to turn the phone camera off just briefly. So that's amazing. Do we want to shut the screen off? Or?
Well, I'll show you something else.
Hang on.
If you want to turn that back on for just a second.
I do.
You don't get to see this very often.
Hang on. Let me get this all set up here. Okay. What's up?
Okay. In this area right here. Oh, that's a beautiful view. Now, if you see up here, the point, the corner of these vertebrae,
they're kind of pointy.
Very, very distinct.
Uh-huh.
When you get down here we have a little blib. Here's one here. Here's one here. And down here, and this one is sticking out further. And this one.
Uh-huh.
This person, even though he didn't know it didn't happen when this happened, but this person had been in a whiplash accident.
Really?
Now, whiplash, say about whiplash injury. Whiplash is not an injury. Whiplash is the accident that caused the injury. And so it has damaged the discs in here. And I did not see this person very often for many years after I moved out of this office. But at some time in this man's life before he passed away, he would have developed a big long spur out here on these two vertebrae.
Oh.
And that these two discs would have eventually collapsed. But these things happen, and this accident, after this accident happened, whatever caused this condition would not have started to develop for at least a year to a year and a half after that accident. So if you happen to be in a serious whiplash accident, sudden start-stop injury, don't be very anxious to start filing release forms, because these things take time.
So what is the bone spur? Is actually like a callus or something that develops on the bone, or?
No, I hope I don't get too complicated with this, but these spurs that you see that people refer to as arthritis. Well, yes, it's an arthritis because that's an inflammation of a joint. That's what arthritis means. Arthro is joint,
Itis is
itis is
inflammation.
inflammation. But they say this is a bone spur, but what happens is where that spur is, that substance, that particular structure used to be a ligament or a tendon. And because of the injury, the same cell structure turns to bone. And so the bone follows the outline of that ligament or tendon. And so on an x-ray, as you're looking at it, that isn't just one spur there, it's in a semicircle. And because you're taking an x-ray and it's going through it, you get the thicknesses of both sides of it. And so it resembles a spur, but actually it's in a semicircle. An x-ray is nothing more than a shadow of light. That's all an x-ray is. I put my hand up in front of the light and you make a shadow. You can twist your fingers in all sorts of shapes and make dragons and all sorts of things. But an x-ray is nothing more than a sophisticated shadowgram.
Huh.
So x-rays are useful, but the technology of MRIs and CAT scans and 3D imaging and everything makes
X-rays pretty obsolete.
Pretty obsolete.
Well, and X-rays only do hard tissue. You can't tell anything about soft tissue through an X-ray.
And soft tissue injuries will not show up for at least 6 months after a given injury. Now,
Really?
MRI will show it, but an X-ray will not.
Wow. So there you go, guys. If you get into a car accident or an injury or something like that, don't
make
be so
sure
quick.
you get it checked out thoroughly before you start signing any releases, because your day's coming. I guarantee it.
So are we done with the X-rays?
Yeah, we can
right.
turn the machine off unless somebody would happen to want to come back to it for some reason.
Let us know if you have a question or anything on that.
And after I could not stay in that office any longer because things were happening there that I did not like. When the man and his wife were in practice together, they spent $1,500 a month on advertising their clinic. Now, $1,500 now doesn't mean a whole lot,
Right.
but at that time, that would have been the equivalent of $4,000 or $5,000. And they were advertising in a lot of local newspapers and things about chiropractic versus this condition. Chiropractic versus this condition. And it gave people the impression that they could cure about everything. And I find fault with my own profession because sometimes they have done that in the past. They get good results in one instance, and so then they say, okay, that's in our field of practice, and we can do this. Well, that's fine if the spinal column and the chiropractic profession can help that condition. If that's what brought about the condition in the first place, yes, you're going to get results. But you're not going to get the same results when every person that has that same condition, because their genetic pattern is different, their social life at home is different,
Their jobs
the
are
way
different.
they grew up, their jobs, their accident history is not the same. So you have to consider each person. Now, I mentioned with Wanda, my student patient, that we got rid of her migraine headaches. Am I promising anybody that all you have to do is go to a chiropractor and get rid of your migraine headaches? Absolutely not. That's not the way it happens. That's the fault I find with the medical profession now, is they put everybody in the box and everybody has to fit in that box, and they come up with these averages. It doesn't make any sense. So anyway, that's a different story. But when I could not, I went back through their financial records, and they had thousands of dollars on the books that had never been collected.
Oh.
Because people took their advertising, came in expecting to receive these fantastic results, and couldn't deliver. And so they refused to pay the bill.
Well, I guess if you go in there for a specific thing to be fixed and they don't fix it, why should you pay the bill?
Yes, and I had.
You wouldn't do that with your car.
I could not live with my conscience and stay there and try to collect these bills and things, because the lady moved out of the office and moved to California and left me there, dumped the whole office procedure on me, and then I was renting the office from her and sending her money all the time. And it just wasn't working. I was working too hard for nothing. So, but in the meantime, one of the last patients I worked with before I left the office was Patty. And I won't give you any more information about Patty because she's probably still alive.
Okay.
But when I first saw Patty, she had been coming into the office for at least a year prior to my coming into the office. And the woman was supposedly treating this girl several times a month. When I first saw Patty, she was 3 years old. She had been diagnosed as cerebral or cerebral, depending on which side of the Mississippi River you're on, cerebral palsy. At 3 years old, She could not walk. She could not talk. She had a lot of involuntary movements and was not doing well. The lady supposedly was giving her treatments, and she was doing it by the mother holding her down, restraining her arms and legs, while the lady was manipulating the neck. That child was not being treated. There is no way you can treat a child if they're fighting you, if they are afraid of you hurting them.
Well, yeah, you need people to relax and everything for those manipulations.
So I was very happy when she packed up her things and went to California. That left me there to take care of this child that needed help. And we can, in sometimes those instances, give them some help. So the first thing that I did is got rid of my white smock. This is when people were professional. Now, the way some of our medical people dress, a New York bag lady wouldn't be caught dead wearing the clothes that they do. The first thing I did is started wearing bright colored, flowery shirts and got away from any of the white things. Just done away with it whenever I had a child come in. So I drove 30 miles to Bountiful, Utah, and bought some special oatmeal cookies, sweetened with honey, not sugar. I've been conscious of diet since 1961 particularly. I went down and bought this little girl oatmeal cookies, and I got to a point that I would just have her mother bring her in the office, sometimes twice a day, just in the office and walk around, not even do anything. And finally, I got her to a point that I could get her to come to me. And I just hold her in my arms and walk around the office with her and show her things, point out and talk to her. And give her a cookie. Bribes work.
Bribes work well.
That I worked with this little gal for about a year and a half. And in less than a year, she was walking and talking. And the last time I saw her, she was riding down the sidewalk on her little tricycle. I did contact the family several years after that when this young lady was getting married. And later I found out she had children of her own. But she had very few symptoms held over from the palsy. And I have to throw this in. Do you know what the medical explanation was for this?
What?
Chiropractic didn't help. That was just a misdiagnosis.
Oh,
It was not
wasn't
cerebral palsy. It was a misdiagnosis because chiropractors can't help that. Now, can we help every? No. This happened to be one that there was a history of a very difficult birth, and when they use these forceps and stuff, the thing they do to those kids, getting them out of that birth canal,
is not always good.
If they treated the dog like that, they'd be hauled away by the Humane Society and thrown in jail.
Oh yeah, Pete would be all over them too.
But anyway, it just, and this history was there, and with the X-ray evidence that we had, there was a particular problem in the cervical spine, and we were able to correct that, and along with it, the child development, and got over that condition. But I didn't do it. all I did is allowed the innate ability of that body to heal itself. That's the answer right there. Our whole healthcare system is trying to find a cure for something that should have been prevented in the first place. I'm getting philosophical here. Anyway,
It's okay. You can get philosophical, Doc. You're allowed.
After that, I had to move out of that office, and I closed it. They attempted opening it several times after that, but the reputation there was too bad. It was never, ever successful. So I moved my practice back in Morgan, and that's the small practice I had for about 2 years. And then I finally moved back to the Roy area and opened my own office. And I bought a big home and remodeled the basement of my office into a walkout basement. But while I was remodeling the office, my reputation got around, and so a few people were coming to my home, and I set up some adjusting tables in the front room of my home, and I would take care of a very limited amount of people. But it just happened that Agnes and Lester had been transferred from Pennsylvania, an Air Force Base in Pennsylvania, and they were transferred to Hill Air Force Base. And they got notice of that I was a chiropractor in Roy area, and sometimes I made house calls and that they could come to my office. So they did not know who to come to, so they came to my home, and I agreed to accept them as patients. And giving you a little background, Lester had been married before, and his wife had passed away. She had some liver or kidney disease. And so he had remarried. And the lady that he married had never been married before. Both of them were getting kind of up in years, and they had been married for 11 years prior to moving to Utah, and had done nothing as far as birth control or anything, and she had never been able to get pregnant. So I did my initial examination and got all the case histories and everything, and started treating her for a period of several months. And then I was able to, by that time, open my office and get my x-ray machines and everything in the basement. And so they started coming to my regular office. But over the period of months, now at that time, it was customary for chiropractors to just adjust on bare skin rather than through clothing. And now they've pretty well gotten away from that because of all of the issues of sexuality and everything. And so
lawsuits, yeah.
Not more of them, most of them don't have people. When I first opened my office, I would give them the option of just wearing a blouse that opened down the back that I could undo some of the buttons, or if they wished, I would put them in a hospital type gown to adjust them. But over that period of time, you get to pick up the texture of a person's skin. And I'd experienced this with many patients that had become pregnant after coming under my care, and I could tell by the texture of their skin when they were pregnant. Now, all of you women know that you go through a real harsh hormone change here during the pregnancy. And your whole body physiology, your attitude, and everything changes.
Her attitude.
Be honest.
Uh-huh.
You know
It
that
does.
happens. But anyway, I happened to just notice one day that this lady's texture was changing. And so here she is now, 50 years old, 49 to 50 years old. And so I commented, I said, have you contacted an obstetrician? And she said, why would I need an obstetrician? And I said, well, because you're 49 to 50 years old here. You've never had a child before, and it's going to be a difficult delivery, and you may even want to consider cesarean section. She says, what are you talking about? And I said, you don't know that you're pregnant? I can't be pregnant. I'm 49 and 50 years old, and I can't be pregnant. We've been married for 11 years. We've never taken birth control. I can't possibly be pregnant. And I says, ma'am, you are. I said, trust me. If you want to, you go to your obstetrician. And if you are not pregnant, I will pay for your office call. Can you ask for anything more than that? But at your age, you need to be under care early. And she babbled around a little bit. She and her husband left. And their next visit came back, and certainly she was pregnant. And the man, he is now approaching 60. And he said, what's going to happen to me? He said, I'm going to be 75 years old out there trying to play catch football with my son or daughter or somebody. So I drove 30 miles up to Brigham City, Utah, and bought them tickets at a movie theater in Brigham City, because that's the only place the movie was still playing. And the title of the movie, It's Never Too Late. And that is a movie of a couple in their elder years becoming pregnant and dealing with a new baby.
Oh.
It set the circumstances just perfectly.
and the Hollywood had a really good timing on that too. I want to take a minute, excuse me for interrupting, but I want to take a minute to mention our sponsor, Mr. Man's Soaps. So you can find Mr. Man Soaps at mrmanstuff.com. And they are all natural. Some contain activated charcoal for detoxing your skin. It will draw impurities out. Some of them have oatmeal or salt so that they're great exfoliators. All of them are all natural and earthy tones, the fragrances and everything. Again, all natural ingredients, all natural essential oils, and they come in a variety of different fragrances. For men, there's about a dozen to 15 of them, and then there's also Mr. Man stuff for women, and they come in two fragrances. You have floral fragrance or you have a berry fragrance. Again, all natural ingredients. My hubby has a cupboard full of them because he doesn't ever want to run out. And Doc Vern has actually tried one of our Mr. Man soaps. And what did you think of it, Doc?
Yes, it was very delightful. I used the bar this morning when I showered.
And he smells wonderful.
It has a very pleasant, it's not an overwhelming odor. It's a very pleasant.
And I hear his wife likes it too.
She has commented about
So MrManStuff.com. Thank you, Mr. Man Stuff for Mr. Man for sponsoring us.
that. Yeah.
And back to you, Doc. We're gonna go on. We are at an hour now, but there is one more story that Doc Vern has told me in the past that I would really like for him to share. The baby with the hips.
Yes. Yes. I can.
If you guys would bear with us, it's definitely a story worth hearing.
Yes. You never know what you're going to run into when someone walks through the door of your office. That this lady in her mid-40s just came in the office, and I could tell that she had a kind of an unusual gait. We get to notice that. I can see people walking down the street, and I can see that their gait is out of balance. I can see the height of their shoulders. One shoulder is always lower than the other. And you know immediately, well, that person has problems with their sacroiliac joint in their spine, because you can't walk that way this distance without putting stress on that part of your body. If it's a woman, she'll generally be limping on the left leg, one leg shorter than the other one, and things are out of balance. So you know if they're taking a step, their spine's twisting rather than rotating evenly because the legs are the same length, or that there's not a muscle spasm there. So you know a person's having a problem. But when she walked in, her gait was different, but it didn't appear to be anything serious. But I knew that that's one of these things that I didn't want to do anything with without finding what the problem was. And here she gave me the story is that she'd been square dancing, and recently she hadn't been able to do the twisting around and the twirls and things that they were doing, and her back seemed to be kind of stiff. And I said, well, we'll see what we can find out. So I took the x-rays. Here again, you can see a lot of things way ahead of time. You develop a set of x-rays. At that time, you were looking at, till they were totally dry, was at least an hour and a half to 2 hours. But by changing them out of the developer into the fixture, and then fixture into the rinse tanks, you can put them up to the black light and determine contrast so that you don't overexpose them, or if it's not quite enough, you can put them back in the developer and increase your contrast a little more. You get a lot of information. Well, as soon as I put them in the rinse tank, then I could see what her problem was, and I was just flabbergasted. That's the only thing I can explain as to what I saw on the x-rays. Now, I don't know, it'll work here if we put this
I'm gonna.
spine up here again.
Okay, gotta get right back to it. Hang on a second here, folks. Gotta get back into the studio. I sat on the phone and changed it. So, all right. Give me a minute. Please bear with us. And there it is. Oh, let's turn the camera on here. Oh, we don't see it. It's not going to be able to. Here, let me See if we can hold this up a little
okay.
bit. There you go.
Well, anyway, this is the way the pelvis looks. But over on this side here, there's this round hole. It's called the acetabular cavity, and that's where the head of the femur bone fits in there to make the hip socket and the joint. Well, instead of the ball of the femur head being in this socket, it was clear up here.
Is that the ischium?
Ischium bone, innominate bone is the whole thing. But it had formed a new socket up here on both sides.
So let me try it here. So where your hip bone goes in right here, hers was sitting up here, right?
Yes.
So it should be down here. It was up here.
And this was on both legs. Now, that had to be when this child was born. And she was in her 40s. And so it had been that way for 40 years or more. But the bones, here again, it probably happened at birth. They must have used instruments, and they dislocated both hip joints at the same time. And the baby's bones, particularly the hip bones, they're in several pieces because there's cartilage in between these bone sections that gradually harden into one solid bone. But the bones are very soft and pliable when the baby's first born and the first 2 years after birth. And so the pressure had been against the softer tissue for all of the early years, and it had formed a whole new acetabular cavity besides the original one. You could still see the old original acetabular cavity, but here was a new one, and it obviously had synovial fluid around it also.
Synovial fluid is the fluid in your joints that help to keep them lubricated.
And so this was on both sides. Otherwise, it would have been noticed much sooner.
Oh, because she would have walked it completely.
Yes, if one had just been dislocated, and they had to both be dislocated at the same time and right very shortly after birth, otherwise the bones would have never developed, indented and developed that joint, and the child probably would have never been able to have walked. With the pressure there and the child learning to walk, crawl, and I have no idea about the history, but it was that way. The body had adapted to that new positioning.
Well, is that something that people might have occurred during like a breech birth or something, with them pulling?
Well, it's very possible. It had to be pretty forceful. It had to have been done. I can think it has to be at the time the baby was born.
Wouldn't the baby have been like completely fussy, crying all the time, in pain?
Well, not necessarily, because it's very easy for a baby's hip to be dislocated with any kind of difficult delivery. And it's a very simple thing to check. You just lay the baby flat out on their back on a substantial surface, and then just bring both of their ankles up, bending their knee, keep their feet on the flat surface, and bring the legs together and just look across the top of the knees. And that tells you instantly whether one hip is shorter than the other one or not. But in this instance, if they did that, both legs would be the same,
right?
if they were both dislocated. So it was very unusual. But the sad part of it is when I showed the lady her x-rays, she thought that I was trying to rip her off some way and that I was showing her someone else's x-rays. And she stormed out of my office, and I have never again seen her to this day. I'm sure she's passed away by now, but I never did see her again.
And you don't know whether she got help for it, whether.
Well, there's really no help at that time.
Yeah.
Because it was functional. She was still able to walk, and she had been dancing. And so there's nothing to correct at that age. There's just no way you can do that. It would be senseless to try and go in and put those legs then back in this socket that was not large enough then to even accommodate the ball of the femur.
Okay, so let's go a little bit into that. Why wasn't it? Because this forms as the bone grows, the socket grows to fit. So since there was no bone in there, the hole for the socket was still the size of a baby's.
Still very small. Size that it was born, and naturally, every one of us, our bones get bigger as we grow older. Mm-hmm. So it would have been senseless to try and do anything with that condition. You just had to live with it. Wow. So I don't know what happened to the lady, and I've wondered about it for all these years. But it's very interesting, the capabilities of this human body if we give it a chance.
Oh, yeah. To repair itself, to readjust itself. A lot of things, there are a lot of people with my foot and everything like that, I've noticed that, getting tired on this leg causes me to put a lot more pressure on this leg. So when I look at my legs side by side, my calf and my thigh muscles on my right are a little bit bigger now than my left leg. So because I've been using them more to compensate. So yeah, your body will adjust itself. But I'm getting better.
Disuse atrophy.
Yes.
that happens. When I was in the hospital and was a quadriplegic, I lost 90 pounds of body weight in 3 months.
Wow.
Most of that was disuse atrophy.
That's a lot. So your muscles don't take very long to atrophy at all, do they?
No, you lose an inch a week with total disuse. You lose an inch a week in girth of your leg muscles.
Wow, that's incredible. That's amazing. I didn't know it was that quickly.
Yeah.
Wow.
Disuse atrophy.
So get out there and walk, exercise, anything to keep those muscles strong and viable.
No, I have a lot of fun sometimes now, but people get talking about, oh, I lost 30 pounds in 6 months. And I said, that's nothing. I lost 90 pounds in 90 days. So what's that? Well, how did you do that? And I said, oh, just go out and break your neck and become quadriplegic, and it takes care of itself. You just lose weight automatically. I don't recommend it, but go ahead if you want.
I don't recommend it. But the bad thing about that is no matter how hard you try, you'll just lose muscle. You won't lose the body fat.
So you lose it all because the body uses it up.
Yeah, that's good. Well, thank you again, Doc, for being on here. I hope you guys really enjoyed some of the stories that he's got to tell. He's got a ton of them, and some of them are extremely interesting. Some of them are, wow, amazing, and they're all good. I just love Doc Vern's stories. He's got a lot of stories, let me tell you. Maybe we'll have him talk about the ghost ship again because we did a show. It's on YouTube from Mesquite today about the ghost ship, and that was a very interesting one. So, but we're gonna leave you hanging on that one. It's a very cool story, and maybe Doc Vern will tell us about it when he comes back.
Be happy to do that.
All right, and thank you again. I can't tell you how much of a pleasure it is to have you here.
Well, it's fun to reminisce a little bit and share information. That's the thing I want to do more than anything is to see if we can wake our society up a little bit because our healthcare system is broken. We're going about things the wrong way. We've got to stop what we're doing now and make a change. We've got to prevent things from happening. And I don't mean with vaccinations and all that kind of stuff. That's a whole different subject. But our health care, as far as what we eat, what we drink, what we do, that's the thing that bothers me more is what we're doing to ourselves in our everyday activities.
And you can go to one doctor, and I know people trust their doctors an awful lot, but realize that if it use it or lose it. So a lot of the information that doctors have learned over the years or learned many, many years ago, if they don't apply that information, it's not viable information in their brain anymore, and they forget about it. So, if you go to a specialist, don't ask a foot specialist to tell you anything about pediatric care because they're not going to be able to. They stick to their specialty, and then pretty much that's all they know is the information that goes along with their specialty. And everything else, the broader spectrum of things, is really forgotten. And
I heard an expression when I was doing my internship in college. And the description there was a specialist is a person that knows more and more about less and less.
there you have it. I think that on that note, we're going to say goodbye. You guys all have a great day.
Be safe, be well.
Yep, we'll see you next time. Unless, of course, you see us first. Have a great day.